Hey everybody, welcome. My name is Dr. Kelly Peterson, also known as the Belly Whisperer. I'm a physical therapist that specializes in pelvic, visceral, and orthopedic physical therapy. I just got done doing a webinar, live webinar for perineal massage and scar tissue mobilizations for treatment, pregnancy preparation for labor and delivery, and recovery postpartum. If you are curious and you are wondering how this can help you, link in my bio and in my story right now, Mama Stay Fit. They have access to that video for 1 week. So if you want to download it and access it, the video is available on her website. Just link in my bio and you can access that. So if you're curious about what you missed, we talked about what the perineum is. We talked about how to find it, how to do self-treatment, how to use breathing, right? Diaphragmatic breathing, how you can use dilators, you can use wands, you can use squishy balls, you can use pillows to help with scar tissue mobilization. A lot of people think that once you've hit your 4 to 6 week mark, you've seen your OBGYN, you're good to go. But for a lot of us, we have scar tissue restrictions, or you still have pain, numbness, tingling, burning. You have a lot of issues that are still going on. So seeing a pelvic floor physical therapist and talking with somebody to learn about scar tissue mobilization and treatment techniques is really important. I tell a lot of my patients that you are able to start physical therapy techniques right away. You can work on education. You can work on posture and breathing right away to help with healing your perineal tear or your scar. If you're curious about learning what are the degrees of tearing, 1 to 4, what to look for, how to help prevent tearing with perineal massage, this webinar is really something that's going to help you out. It's a whole hour. It has a lot of information. I realize that I have a hard time not going into detail with a lot of things, but not only do we go over self-treatment, mobilization techniques, I show different techniques for breathing, for stretching, how to use, using balls, using pillows, using different techniques to help stretch that area. Your pelvic floor muscle is like any other muscle in your body. It needs to be taken care of. You need to do daily things to help keep it healthy. If you just neglect your pelvic floor over time, you're going to have issues, right? You always hear about people having incontinence issues. You hear about pelvic organ prolapse. You hear about constipation, all of that. So if you're curious to learn about perineal massage, how to help heal from perineal tears, check out the webinar. It's really fun. We did a lot of information. But yeah. And if you're looking for a more thorough evaluation, or you want more of that one-on-one for your perineal tear or your scar tissue, link in my bio. I have online and in-person appointments for this. I know a lot of people don't think that you can't get anything done via Zoom, but there's a lot of things that you can learn from just education to help with healing, right? And if you can, then you can see a pelvic floor therapist as well near you. And if you're somebody that's local in Orange County, I have in-person appointments in Irvine, California on the weekends. And again, like I said, I have online appointments. If you're somebody that needs help with healing postpartum, or if you want to help enhance your pregnancy, help with preparing for labor and delivery, I also have my online program, the Belly Whisperer Method. There's a lot of information, 22 videos, there's PDFs, home programs, handouts, there are guides to finding specialists near you. There's a lot of information in that program. You can link in my bio to the Belly Whisperer Method online program. I've been getting a lot of really good feedback from people recently. I'm really excited where it's going. And if you have any questions, feel free to put them in the chat box. Is this relevant to women who've had a C-section? I talk a little bit about C-sections just for a little bit, discussing the different layers that they cut through, going through and talking about how to help with healing for getting in and out of bed and posture. I kind of touch a little bit on C-section, but this webinar is not for specific C-section scar mobilization. I have another video already on my website. If you link in my bio and you go to my link tree and you click self-care home videos or self-care videos, you can access a C-section scar mobilization. I do one with my hands. I use one with myofascial decompression or the cupping, and I think I have another one with using tools to help with scraping. So A lot of people think when you're doing scar tissue mobilization, you should go directly over the scar and you should really dig into scar tissue. And a lot of people even think about, coming here and doing cross friction along the perineum, cross friction where you have a scar. But for a lot of us, that can be really uncomfortable and it can be hard to tolerate, and it may not even be the source of your problem. So if you're looking for more information, like I said, check out the webinar that I did with Mama Stay Fit. It's in my story. We just put that link in there now. And like I said, you can have access to it for a week and you can download it. And I will also be uploading it later, but check it out. Great question. Even if you've had a C-section, you still want to also go see a pelvic floor physical therapist. They can help check out your stomach, help with wound care and healing. They can assess for diastasis or hernias. So really important. All right, so I just wanted to go on and let everybody know that video is going to be up and available. So if you have any questions, you can check it out, and hopefully you can help heal your perineal tear. Thank you, everyone.